served during the Vietnam era, Army, and was injured in a motorcycle accident 17 years ago. I feel comfortable at the SCI clinic. They know my needs a whole lot better than everybody else does, so I've continued to go to Dallas, and that be my primary, but it's 80 miles.
Well, I'm a C5, C6 quadriplegic. I was in the Army from 1980 to 83. It wasn't long after I got out of the Army that I ended up getting into an automobile accident and broke my neck. The number one thing I like about telehealth is not having to drive to the VA.
So when we do telehealth, they're in a more relaxed state, they're at their own house, they have their medications right there, so if I have a specific question they don't remember, they can literally look at the bottle and see, exactly what they're taking and tell me exactly what they're taking.
Good morning, how are you doing today?
I'm fine, and you?
Pretty good.
I mainly see patients when they come in to the Spinal Cord Injury Center for their annual exams, and so on that day they see everyone. They see their physician, they see psychology, social work, PT, OT, so it's a hectic day, and so sometimes squeezing in pharmacy is a little bit difficult, but by doing CBT I see them beforehand, and then I'm able to go through all their medications and also help triage any kind of major concerns they have.
Still taking the Atodolac, doing 1 tablet twice a day as needed for pain.
Yes.
Still taking the low-dose aspirin every day.
Yes, ma'am. This way I can spend 30 minutes on telehealth and have the answers that I need and the consults, and we just connect, and it's like I'm right there.
Are you able to position your camera up a little bit more so I can see your face?
Sure.
One of the biggest things is convenient, right? It's convenient not just from the provider's perspective, but from the veteran's perspective as well, because within less than 5 minutes we can hop on and we can connect, and whatever the patient's issues are, we can usually deal with them in a very efficient and effective, timely manner.
I see here that you are taking Laxatine and gabapentin for your pain. Is that correct?
Kind of depends. In the morning are my better times.
Okay. Do you use any mindfulness?
I do. In fact, I went through the course, and I did that via teleconference as well. I mean, it's brutal when I'm taking the drive, and I'd much rather drive into my office than having to drive all the way down into Dallas to go to see my doctors.
How many capsules a day are you taking?
Just one.
Just one once a day?
Yes. I'm seeing my same physicians and nurses that I would if I had to drive to Dallas. I just don't have to spend all day driving to Dallas and back.
It's so convenient. You can use your computer, tablet, or phone, and instead of driving all the way down into Dallas, you can just go see your provider in your fuzzy slippers.